Hello everyone. In this meeting, I am going to review the materials on checking vital signs. The first picture is oximeter. It is to check oxygen saturation and respiratory rate. The second is sphygmomanometer. It is to check blood pressure, and you can also check pulse. The third is stethoscope. It is to check pulse. And the last picture is pulse oximeter. It is to check oxygen saturation and pulse. The first is checking oxygen saturation. While oxygen saturation or blood oxygen level describes the level of oxygen in the blood, it is to measure of how much oxygen the blood is carrying. The expressions that are commonly used are, I'm going to measure your oxygen saturation level. Is that okay? Please give me your right hand. I'm going to apply this probe on your finger. It won't hurt. Would you please rest your hand? Your blood oxygen level was 95. It is normal.
Blood pressure. Blood pressure is the force of the blood pushing against the artery walls during contraction and relaxation of the heart. There are two numbers that are measured, systolic and diastolic pressure. Systolic pressure refers to the pressure inside the artery when the heart contracts and pumps blood through the body, while diastolic pressure is the pressure inside the artery when the heart is at rest and is filling with blood. Okay, the expression to report the result, for example, it is 112 and 64, so we can read it. Your blood pressure is 112 over 64 millimeter of mercury. It's normal, Mrs. Hodge. And then the right position to check blood pressure is supported back. It can be supported by the back of the chair. And then uncrossed feet. So make sure that the feet is relaxed. And supported arm at the level of heart. You can support it by using pillow or just put on the table to make it at the level of the heart or in line with the heart. And then the expression that commonly used to give instruction when you are going to check the blood pressure, for example, please roll your sleeve up. I'm going to wrap this scarf around your arm. Well, the next is checking pulse. Okay, there are two types of pulse. They are peripheral pulse and apical pulse. Peripheral pulse can be measured by palpating the arteries, while apical pulse can be measured by auscultating the apical pulse or the area of the heart by using stethoscope. Okay, on the right side, there is a picture of the pulse sites. Yeah, there is temporal, carotid site, brachial site, radial site, femoral site, popliteal site, posterior tibial site, and dorsalis pedis site. And then the expression that commonly used, for example, we need to measure your pulse rate before give your medication. Okay, this is the example of reporting the result. All done, 82 beats per minute. That's pretty safe for Mr. Allen's medication. Or when you are going to check peripheral pulse, you can say, can you give me your right hand? And to report the result, you can say your pulse is 80 beats per minute. It's normal. And the next is checking respiratory rate. Respiratory rate is the number of breaths a person takes per minute. It can be measured by inspecting the rise and fall of the chest or abdomen, or by auscultating the lung sound. So there are two techniques that we can use to check the respiratory rate, by inspection or auscultation. And the best position for checking respiratory rate is when the patients feel comfort and relax. And then to count the respiratory rate, just count it for 30 seconds, then multiply it into 2 if it is regular. But in some condition, when it is irregular, so we need to count it for 1 full minute or 60 seconds. Especially for baby, you must count it for 60 seconds, 1 full minute. And then we don't need to tell the patient before the respiration checking, because it will make the patients aware of their breathing and alter their breathing pattern. It can lead to inaccurate reading. And we don't need also to use gloves, because there is an exposure to body fluids or personal skin. And then the expression that you can use to report the result, for example, your respiratory rate is 18 breaths per minute. It is normal. Well, that's all the important points that I can note in this presentation. And yeah, have more practice in a quiz. And then if you have any question, just feel free to ask in the forum. Thank you. See you next time.